So guys, in my last video, I talked us through about what menopause means and the signs and symptoms of menopause. So in this video, I'm going to be telling you the treatment options available for people who have reached menopause or about to hit menopause, that is perimenopause. So if this is something you would like to know, keep on watching till the end and do not forget to give me a big thumbs up as you watch. Also, do not forget to subscribe to my channel because here I talk about fertility, women's health, and everything health. If you're seeing me for the first time, my name is Peace Chueze, a registered nurse and midwife, and I currently practice with NHS in England. So let's get started. Understanding the cause of menopause will really make it easy for you to get through to this video to understand what the treatment is all about. But don't worry, it's quite simple and I'm going to really make it simple for you to understand. So, as I mentioned in my previous video, menopause simply means when the woman's ovaries reduces or stops producing those hormones, those reproductive hormones. And we are talking about hormones like estrogen, progesterone. So when we talk about the treatment of menopause, we are talking about the replacement of these hormones. So we have what we call hormone replacement therapy, and that is what I'm going to be explaining to you in this video. So hormone replacement therapy is an effective and safe treatment for people who are undergoing menopause or perimenopause. But before you begin this treatment, it is very important that you have a good discussion with your GP. By having this discussion, it will help you to understand the benefits and the risk of this treatment. When we also talk about this hormone replacement therapy, it simply means the replacement of these hormones which are very low in the woman's body at this time. So what hormones are we talking about? Estrogen and progesterone. However, there are different types and doses of hormone replacement therapy. So when you're given the right type and the appropriate dose, your symptoms will eventually resolve. The options available to you could be the replacement of estrogen. Regarding the estrogen replacement, it can come in the form of tablets, implants, gel or spray, and also it can come in the form of patches. So these are the various forms in which your doctor can decide to give you estrogen replacement. However, if your womb is still intact at the time when you are taking this replacement, your doctor might decide to also give you progesterone. This progesterone will help to protect your womb lining or your uterine lining from the effects of estrogen. And at the time when you are taking this estrogen and progesterone, it is known as a combined hormone replacement therapy. On the other hand, if your doctor is replacing progesterone, it could be given in the form of tablets, intrauterine systems or coils, or it could come as patches. However, when progesterone comes as patches, it usually comes as a combination of progesterone and estrogen. Remember that one of the symptoms of menopause is low sex drive. So if you're experiencing this during menopause, your doctor might decide to give you some testosterone. This is based simply on the discretion of your doctor. So you may be wondering, what are the benefits of having a hormone replacement therapy? A hormone replacement therapy really gives you a lot of relief from many of the symptoms that women experiencing menopause do have. Some of these symptoms include hot flushes, vaginal dryness, brain fog, mood swing, and joint pains. Hot flushes or night sweats often improve within a few weeks. However, regarding the vaginal dryness and mood swing, it can take up to a few months for you to see significant improvements. The second benefit of taking hormone replacement therapy is that it can reduce your risk of developing hormone-related problems, including heart disease and osteoporosis. But it is very important that I let you know that treatment with hormone replacement therapy is not without risk. However, it has been noted that the risks are really outweighed by the benefits. So what are these risks? It has been noted that one common risk of hormone replacement therapy is that it can slightly increase your chance of developing breast cancer. So, women who have had breast cancer in the past are usually advised not to take a hormone replacement therapy. In fact, there are an extra 5 cases of breast cancer in every 1,000 women who take a combined hormone replacement therapy for at least 5 years. The second risk is blood clots. Hormone replacement therapy tablets has been found to increase the risk of developing blood clots. However, this risk is very low. On the other hand, the patches and spray have been found not to increase this risk, especially since they are really absorbed into the body through the skin. So, if a patient has been found to be at an increased risk of developing blood clots while taking this tablet, your healthcare provider might decide to encourage you or prescribe that you take the patches or spray instead in order to reduce this risk. The third risk is the risk of a stroke. This is common, especially when the patient is greater than 60 years of age. At this point, I would like to ask you to please subscribe to my channel and give me a thumbs up if you are getting any value at all from this video. So let's proceed. The next treatment is treatment for vaginal dryness and discomfort. Remember that during menopause, many women complain of having very dry and itchy vagina. In this situation, your doctor might decide to prescribe some estrogen treatments which can come in the form of a tablet, cream, or rings. These treatments can be inserted into the vagina and they will help to manage those symptoms and discomfort you're feeling. Also, if you've been diagnosed to have some mood symptoms or depression, antidepressants could be used to manage this as well. And as you take this medication, you will see a significant improvement in your mood. Another form of treatment which doesn't involve the use of medication is known as cognitive behavioral therapy. This is like a talking therapy which is used to help people who are undergoing mood problems like anxiety or depression. And this is very common in many women who are undergoing menopause. So this is also another form of treatment that is available for women undergoing menopause. So, having come to know all of these different treatments, what should you do next? When you've been started on any particular method of treatment, you are expected to go back to your doctor or the nurse prescribing your medication after 3 months. So at the end of 3 months, you go back for a review, after which you will have to agree or disagree if that medication is working well for you. If you agree that it's working well for you, fine and good. Then you will have to go back, continue taking your medication and come back again for a review after 1 year. When you come back after 1 year, your doctor will have to review to find out if you're having any side effects with the medication, if you're having any good improvement. Your doctor will also check your weight and blood pressure and have a review of your medication to be sure that the type of medication you're taking and the prescribed dosage is just right for you. So, that is all I'm going to be sharing with you regarding the treatment of menopause. If you found this really informative, please give me a like and consider subscribing to my channel because here I give you information about fertility, women's health, and everything health. Thank you for watching and I'll see you in my next. Bye for now.